Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight, just when you thought COVID was over, life was getting back to normal, comes a dire warning from the World Health Organization. We are at the tip of an iceberg, and the recent uptick in COVID cases, which we are seeing all around the world, could be just a fraction of the true number of cases. And that's partly linked to a sharp decline in testing rates around the globe. What's more, there are reports now of a new variant of COVID-19 which has been detected in Israel. India is presently on alert as the numbers in parts of Asia and in Europe appear to be seriously spiking. Joining us now, Professor Devi Sridhar, Professor and Chair of the Global Public Health Department at the Edinburgh University Medical School. Thanks, Devi, very much for being with us. Firstly, let's talk a little bit about this new strain in Israel. What do we know about it?
Well, it seems this was picked up in two travelers, and it's a mix of two existing strains that we know about, BA2, which is now becoming the most transmissible strain, as well as an earlier one. But there's no cause for concern yet. There's no indications it causes more severe disease or that it'll affect our vaccines any differently than BA2, which again has a similar profile to Omicron. So again, I think great that we're picking this up. It shows the sequencing ability is there. We're detecting these quickly, but actually there's no real reason for people to panic yet.
But it does go to show that this is a virus which is constantly mutating, and therefore we may get lucky with this new Israeli variant, whatever it turns out to be. But the fact is that this could again take on a much more hostile form because it continues to mutate, so that the danger is not over. We've had maybe a good couple of months, but that's it.
Exactly. I think that's completely right. And virologists do say we got lucky with Omicron and BA2, that they cause milder disease than Delta. Although it is not a mild disease, you only have to look at the death rates in Hong Kong, in the United States, to see Omicron is killing those who are unvaccinated. But again, our tools for managing this are the same, which is we need to make sure we keep testing, making sure those who are infectious are isolating, use your masks if you don't want to become infected. We know one-way masking works. You can protect yourself by wearing a good medical grade mask and getting vaccinated and boosted. We know the booster dose does help bring down that mortality line quite low compared to being if you're unvaccinated.
Why is the World Health Organization now saying, and it's fairly alarming when they're saying that this is just the tip of the iceberg in terms of what they are projecting, a huge upsurge, a huge uptake in cases around the world. Why should that now be happening?
Well, we know that BA2 is incredibly transmissible as measles, if not more. And so what that means is that as societies open up, people want to get back to mixing, back to going to work, back to going to weddings and parties. This is infecting many people. And we know that it can still infect you even if you're vaccinated, but hopefully you will have a milder illness and can manage that at home. And so what we are seeing is this incredibly transmissible virus taking off. And they say it's the tip of the iceberg because in places like Britain, we have something called the ONS, that's surveillance where they randomly test people to see how much COVID is out there. And the figures are astonishing. 1 in 20, 1 in 15, 1 in 25, week after week after week. And so if we are seeing these numbers here because we are looking for it, it is likely those numbers are being seen in other places. They just don't have the ability to pick it up in the way Britain has been able to detect and keep track of those numbers.
But let's just look at those numbers. The United Kingdom also has fairly high rates of vaccination now, including people who've been boosted. So this is yet another major concern that, this is a virus which continues to defeat the boosters as well, potentially.
Well, yes, we know that it's not 100% effective, and especially if you're in an elderly group. For example, in Scotland, a third of admissions over 75 are people over 75 who have been vaccinated and boosted. But again, if you're having one of those risk factors, if you're elderly, if you have a comorbidity, this is not, let's say, a silver bullet. It actually will help you, protect you, give you an additional layer, but you still need to be cautious around this virus. And so it's a real challenge now because there's both fatigue from restrictions, people want to go back to their normal lives, but at the same time, it is still a dangerous virus to those who are unvaccinated or those who perhaps have underlying issues or are over 75 and might still have severe disease even with vaccination.
Devi, those who are in that 1 in 15 or 1 in 20 in the United Kingdom who are testing positive for COVID, are they largely unvaccinated?
No, actually, they're largely vaccinated also because our vaccination rates are so high. I mean, over
What are the vaccination rates presently in the UK, Devi?
Well, I would say it's over 95% in elderly groups and it's over 90% in the general population, and then it drops down for 12 to 15-year-olds, and they still haven't yet rolled out 5 to 11-year-olds. But antibodies, to give you an indication of some protection, is over 98% overall in the population. So we have very high, you can say, antibody levels from infection or from vaccination. And that's not stopping the rise in cases, but it is helping us manage hospitalizations and the pressure on the NHS. We would see many more deaths if we didn't have vaccines in play right now, given the high case numbers. And you can only see Hong Kong to get an example of what that could look like.
I think the big worry also is the lack of boosters in certain countries. For example, where I am in India, I had my second dose more than 9 months back. So had I not had COVID in between, and sadly I did catch COVID despite all of our conversations and all of the efforts that I made a few weeks back, but had I not had COVID then I would essentially be unvaccinated because there is no booster policy in India. Isn't that a big concern that we now need to globally start thinking about boosters, because you have to have boosters because your original vaccine doses were delivered perhaps a long time back and they just don't work anymore?
Yeah, well, I wouldn't say they don't work. If you look at the mortality curves, it's unvaccinated, it's 2 doses, it's 3 doses. And so what you're really looking for is to keep pulling that line down through offering boosters. And WHO advice is, in fact, now to offer a 3rd dose. The thing I would say, I'm sorry to hear you had COVID-19, but for those getting it, they shouldn't feel any guilt or any shame about this. This is a virus, and this is why we're seeing rising rates, which is finding everybody. It is so transmissible that even if you are being cautious and you think you are following all of the guidance, you can still become infected. Yeah. And so that's why we need to move faster in terms of getting therapeutics, getting, vaccines, boosters in place, and hopefully the Indian government will have a shift in policy on that and have the supply as well to get that out.
Yeah. Devi, isn't the biggest concern now that, we really as a global community need to have a vaccine which targets Omicron? I mean, whatever vaccines we've developed in a record period of time, fantastic science around the world, were all benchmarked against the wild strain of COVID-19, not against Omicron. We don't even need to be worried that much, hopefully, about Delta. It's only Omicron and its subvariants right now. So what the science is old. I mean, it may be just a few years old, but it's still old. It doesn't deal with what we are fighting right now.
Yeah, the challenge now for companies developing an Omicron-specific vaccine, which they could, is by the time they develop that, similar to developing a Delta-specific vaccine, is we might have a new variant, which is substantially different, and therefore they're, again, running behind. So where we're trying to get ahead of it, and this is where pharma companies are thinking, is first a pan-coronavirus vaccine.
Right.
So a broad-spectrum one that can look ahead and say what could emerge and how do we cover those, including SARS and MERS. But also, I know Bill Gates and the Gates Foundation and Wellcome Trust are looking into a sterilizing vaccine. That means similar to the MMR vaccine, once you are vaccinated, you cannot get COVID or give it to others. And that's the ultimate prize. Because in many places, like in Britain, we would have eliminated SARS-CoV-2 if we had a vaccine that would stop you having it and transmitting it if you were vaccinated. And so those are the 2 things where you're seeing a lot of investment. One, which is broad spectrum, saying we're not going to chase variants, we're going to try to get ahead of it to what could emerge. And also one that actually will stop you getting infected at all, which we know is a challenge with Omicron in our vaccines.
And where do we stand in terms of timelines of developing a pan-COVID vaccine?
Well, I think we're looking at 6 to 12 months right now. And so that's the time scale. The hope is hopefully by next winter. I think the idea, at least in the Northern Hemisphere, is that we will have a more peaceful, though of course we're seeing SARS right now, COVID-2 waves emerging in Europe through the summer. And then next winter prepare to say, if we're going to give people a booster vaccine going into the winter, especially elderly groups, how do we actually have a better vaccine by then? But again, any vaccine right now is better than no vaccine. I think that's the lesson. They all work at reducing your chance of severe disease. It's just how well they work, depending on how many doses you get.
Thanks, Devi, very much for joining us. Great speaking to you. Let's just hope that this goes away sooner than later. It's gone away in the case of Omicron, but it's back, it seems, right now. We need to be careful once again. The World Health Organization, very, very concerned indeed. Thanks very much, Devi, for being with us.
Thank you.
Well, joining us, Professor Madhukar Pai is the Canada Research Chair in Epidemiology and Global Health at McGill University in Canada. Thanks very much for being with us. Also joined by Dr. Hemant Thakur, Chairman of the Maharashtra COVID Task Force, and Dr. Rajiv Jayadevan, Vice Chairperson of the Research Cell of the Indian Medical Association in Kerala. Thanks all very much for being with us. Dr. Thakur, we've spoken in the past about boosters. If we've got Omicron being resurgent once again, if you're talking about a new potential variant out of Israel, it may not necessarily be more dangerous, then isn't it time that we started thinking about boosting the general public, not just above 60, people above the age of 45 as well? Dr. Thakur, go ahead.
Yeah, so I couldn't hear your question. Could you be a little louder?
Can you hear me now?
Yes.
No, I'm asking, if we've got Omicron and these numbers climbing once again, isn't it time we started boosting our population, many of whom would have received even their second dose several months back?
So I agree with you that we need to vaccinate more and more people. At the same time, we cannot afford to ignore those sections of society which are clamoring for a booster. We've given enough time to the 60 plus people or the comorbidities plus people to get their boosters. We must enlarge our vaccination potential and give it to everybody, because some vaccination is better than no vaccination. And as you see, cases are going up in China, Vietnam, even a little bit in the West. And that's all because of a lax attitude. They've dropped the mask. Social distancing is going for a toss. But then you must remember that they are vaccinated to a significant number in their population.
Right.
So we have to increase our vaccination, because waning of vaccination immunity and waning of infection, post-infection immunity, is a very strong factor for reinfection.
Yep.
And remember, if there is a virus, it's going to mutate.
Right.
And mutations hopefully will be in a downward way where their virulence will come down. But there is no arithmetic in nature. You can get a virulence which, as we know, the BA.2, which they have seen now in Israel, is a couple of times more transmissible than the Omicron.
Right.
So Delta Omicron, Omicron with BA2, etc., anything can emerge.
Yep.
So we cannot dampen our enthusiasm for protection.
Right.
Keep vaccinating, keep pushing boosters, and don't drop the mask. Don't go and play holy in large numbers. Distance yourself. Do what you have to. Go into your festivals, but do it in a guarded fashion. I still think India is isolated, protected. Let's not bring all these silly variants into our community and country by our own mistakes. This is my advice.
Dr. Jayadevan, and thanks, Dr. Thakur, very much for that word on Holi. People are looking forward to Holi tomorrow, and you just cannot afford to let up your guard. Thanks for sending out that message. Dr. Jayadevan, there's a sense on the basis of several studies which have been done that we have a large presence of antibodies within our society in India, either as a result of the vaccines themselves or as a result of people having fallen unwell and developed vaccines naturally. Is that enough to protect India from a resurgence which we are seeing in other parts of Asia or in Europe right now?
That's a good observation. We, in India, after the decline of the Omicron wave, we have not yet seen an upswing as was seen in predominantly in Europe and in some Asian nations. I'll take you directly to the paper that was put out by the UK Health Security Agency, which had some really interesting news, which is important in the Indian context. They found that if you've been unvaccinated and you picked up a past infection, you are well protected against severe outcomes.
Right.
And that is classified as hospitalization from severe disease or death.
Right.
So that is good news. The second is that if you've been vaccinated, you are much better protected compared to unvaccinated people.
Right.
So if you look at data across the world, I've heard you talk about boosters. If you look at data across the board, I would like this to be very clear to our viewers. The main difference between people who die and people who don't is between the unvaccinated and vaccinated.
Right.
It is not between those who are boosted and not boosted.
Right.
And this is data from Switzerland, data from the United Kingdom, from the ICNARC, that's their ICU critical care data, and from the CDC. You can check for yourself in any of these websites. It's all in public domain.
Yep.
And in the CDC's website, I'll take you through this before I finish. They have subclassified deaths into 3 categories: young adults, middle-aged, and elderly. The effect of boosting is marginally seen in just the older segment. In the other segments, you can hardly see any difference between 2-dose and 3-dose.
No,
and
but,
this is enormous numbers of data.
But Dr. Jayadevan, I take that point, but there are many Indians now who would have had their second dose well more than 6 months back. I just happened to get COVID a few weeks back. But by the time I got COVID, I was 8+ months after my second dose. So there were waning antibodies in any case. There are many who are perhaps fortunate in not having had COVID in our society. And yet, we are still reticent to give boosters to those above the age of 45. And in our country, as you know all too well, sir, comorbidities is a burden we all carry in our society, whether it's genetics or anything else, whether it's heart ailments or diabetes or other issues. So therefore, if people's immunity is waning because they've received their second dose several months back and they are still not boosted, are we not looking at potential trouble for them?
It depends on what you wish to achieve by embarking on this journey. If you are trying to reduce the total number of deaths, it will only happen in older age groups, according to data that's very clearly laid out. Second, if you're trying to reduce the number of infections, if you've had a recent dose of vaccine, or if you've had recent infection, you're well protected for about 3 months tops. After that, your immunity rapidly wanes, and that's what we're seeing.
Right.
Even after a booster dose. And the latest paper from Israel, looking at the 4th dose, they've shown that even though the neutralizing antibodies shot up after a 4th dose, there was practically no difference between a 3-dose and a 4th dose group. So there are things beyond numbers that we need to comprehend when we take policy decisions.
Professor Pai, where is the science, the magic, where is the silver bullet in terms of designing a vaccine which deals with COVID beyond the original strain, Delta or Omicron? I mean, something which really, is that magical silver bullet we are looking for. Where is the science on that, sir?
The science, there are lots of people working on it, Vishnu, but the most pernicious thing that worries the heck out of me these days is that here in the rich north, everybody is declaring the pandemic over. I don't even know what the heck they're talking about. Right down from the Biden administration to what's happening in Europe to most parts of the world, including prominent commentators in this field, are prematurely declaring the pandemic over, which is what prompted Dr. Tedros to say that the pandemic is far from over. And it has a chilling effect on innovation, on R&D and funding. For example, the United States just 3 days ago or 4 days ago cut billions of dollars of funding for COVID. Billions of dollars that would have gone into COVID, gone just like that.
Yeah.
And all of the money is now being diverted towards the war in Ukraine. So I'm just terrified that there will be a complete collapse of all innovation and work in this space. And then we will all be caught blindsided by another variant. If there is a new variant, I think we would all agree it has to be more transmissible than BA2, which is already extraordinarily transmissible, or it has to evade natural or vaccine-acquired immunity. That's the only way a new variant can thrive in this environment that we are in. And the fact that BA2 is already causing such havoc in parts of in Asia and Europe makes me very concerned that the world is losing the plot. And I think we've all seen this before. In the past, TB, AIDS, malaria were all common in Europe and North America. The minute incidence went down, these rich countries completely forgot about these infections. And who is bearing the brunt of it now? Low and middle income countries. That's where TB, AIDS, and malaria is killing people even today in massive numbers. We can't allow this to happen. So my urge is the global south, low and middle income countries must lead on the innovation. They cannot wait for the global north to come up with solutions. And I'm delighted that India has done it with vaccines. India needs better antivirals like the Pfizer Paxlovid pill. We need to keep pushing and not allow this kind of defunding of COVID that's happening in many northern countries.
Professor Thakur, let's talk a little bit about the pills. When I fell ill, I was prescribed molnupiravir, and in my case, it worked really well. And obviously, it was my doctor who took this decision. I wouldn't recommend it. I'm certainly no one to suggest that it's the right one for everyone. But in terms of dealing with future outbreaks of COVID, what role will these pills take? Because they're relatively less expensive, increasingly less expensive. They are efficacious in certain circumstances. Is that really the way we're going to be fighting this?
See, you have to understand that if you are treating a population that's already vaccinated, then you know at the back of your mind that the chances of this being a serious infection are much less as compared to a patient who has not been vaccinated. Now, in the unvaccinated patients, you might want to nip the infection very quickly in the bud. So you could use a potent antiviral, which is available in plenty in our country, and then look for the result. Of course, now in our formulary, we have so many antivirals for initial treatment. We have antiviral nasal sprays for prevention before even then infection can blossom. And of course, we have antivirals which are tested and stood the test of time for delayed patients who come in much later. But now we know the ropes, we know the game, we know the virus, at least we think we do. So we are in a much better position to tackle any resurgence, and to get resurgence is completely in our hands. We cannot let the mask down, and I compliment our government for not doing away with the mask. I wish the government would be a little more pushy on vaccination and relax some of the vaccination age groups, but I'm sure they'll do it in time. India has had the advantage of mass vaccination by the Omicron virus itself.
Right.
It was a wave that went and touched the whole community when they had small bits of Omicron. So we have indirectly been vaccinated by the Omicron, but that doesn't mean we take it lightly, because immunity wanes.
Right.
So we have to keep our guard. I'm not trying to scare anybody or dampen the spirits.
No, it's just a fact. It's just the way it is.
Correct.
Professor Pai, just coming back to my original question, the science was brilliant in the pace in which we came out with vaccines to deal with the original strain, and there were brilliant vaccines, so many of them. But then it seems that we've not kept pace, as a global community of scientists. Why is that the case, sir?
I think it was the expectation somehow that a combination of what we already had, and as everybody knows, even if it doesn't necessarily protect from against infections, vaccines do protect against deaths. To that extent, they have been a resounding success, and we have to celebrate them, right? And so I'm happy, and I'm well aware that I could get COVID anytime, but if I did, I'm pretty sure I'm not going to die, and that is enough for me. And I think if we set our standards on preventing bad outcomes, we're going to be more than fine, because that's what we want, right? None of us ever thought no infection will even happen with these vaccines. So maybe some of that complacency has set in because the bad outcomes are being prevented, and most people are okay with that. Now, but if there was a new variant that was absolutely devastating in terms of its immune evasion, then I'm sure the R&D gears will start turning again. Suddenly investments will be made, and people will work on finding better vaccines. Here in the global north, there is a great interest in combining flu vaccines with COVID, so that anyway, we're being asked to take annual flu shots here.
Right.
And if it's combined with COVID, that might be a way forward to minimize the amount of resources that need to go in. The ideas are, the science is there, but I'm just worried that a premature declaration that the pandemic is over could have tremendous negative impact on how people perceive it, right, or even how governments and pharma companies make investments in it. They may have moved on to other things, big
Sure.
pharma. They will not hang on to something if they think that it's not lucrative for them.
Sure. Dr. Jayadevan, would you agree that, all of us, commenting and talking about COVID and scientists around the world, the goalposts have shifted. When we started talking about this 2.5 years back, when the vaccine came, it would fix COVID. Today, we are only talking about it saving lives. So that's different. but there is also severity of illness, and it's not a pleasant thing to have at all. It is a serious infection, no matter what the age group is, I mean, by and large. Where do we stand in India in terms of some of the vaccines which we are developing, which are forward-looking? Will we see some great science coming out of India?
Well, we have a greater choice of vaccines now than we did in the past. And India has managed to vaccinate its population on a priority basis, depending on who is most at risk. And I applaud the government for that, because if you contrast this with China, for instance, in China, it is the youngest adult or older adolescents who have 100% vaccination. It is not among the older adults. But if you look at India, we got the older adults that are well covered, where at least a single dose, right, which itself is a good thing, especially in combination with an infection, natural infection, as Dr. Thakur rightly said. In one sense, people have called it a natural vaccination. But this is not an invitation to go out and get COVID-19. And I totally agree with Dr. Pai in saying that it is premature to make such declarations. I know it is playing to the gallery of sorts. If you make a statement saying that it's over, then you get a lot of public affection, which can translate into personal benefits for you. And we must stay away from making such statements. I'm glad the Indian government has not made such blunders. Some developed nations have repeatedly made such statements, and each time they've had to go back on their word. Sure. And I hope our government will not do that. And I also interact a lot with people at the grassroots level. It's also important we communicate with people at the grassroots level. Now, they are not scientists, and they want to get on with their life. And if they get the wrong signal, it can mean a lot of difference in the amount of control we get on the pandemic.
I'm sorry, I'm just having to wrap this up. I'm completely out of time on this program, but it's been a fascinating conversation. But I would suggest our viewers watching this program would be rather upset that that mask, which they so hate, I mean, they're going to have to keep that on for a while longer. It is actually our best friend, perhaps even more than vaccines, perhaps even more than drugs. It all works together. Thank you, gentlemen, very much for being with us. Comments on coup. Yashvi says, don't you think India should have a clear plan for the ongoing pandemic for the next 2 years? Manoharan says, we should be careful. COVID not over yet. Quite clearly, it isn't. Out of time. Thanks very much for being with us.